The most common symptoms of post-traumatic stress is an ongoing sense of vigilance. That vigilance might be a hypervigilance to sounds, smells, um, lights, environmental factors. Maybe it's a high startle to certain experiences in the environment. Maybe it's kind of constantly expecting the worst to happen. And that goes along with re-experiencing symptoms, which we typically think of as nightmares or flashbacks. And sometimes re-experiencing is literally like visual imagery or memories that are flooding in, and sometimes re-experiencing is more subtle. It's a felt sense in the body, but it doesn't come with that clear understanding of exactly what it's related to, especially if there was a loss of consciousness in relationship to the event itself, or if the event happened when they were very young. And that will tie into the next two subjects as well, or next two trauma definitions. And then the third most common symptom of trauma is avoidance, the urge to avoid turning toward that emotion, that sensation, that mental experience, because they do not yet have the resources to turn toward that without becoming overwhelmed. And so it becomes this cycle where the more that I avoid something, the more that the brain perceives it must be really, really terrible. And it's why many of our trauma therapies involve a certain degree of exposure to the traumatic experience, because we want to help someone come out of avoidance. But exposure sometimes in our therapy world gets kind of a bad rap, like somehow it's going to, exposure always means it's going to be overwhelming. But honestly, most trauma therapies have a certain degree of turning toward the felt experience or the memory of what happened, but we learn to do so safely, and we'll talk more about that as we go. Then the field has really evolved to recognize that not all post-traumatic stress shows up in this hyperarousal, panic, anxiety, high distress. Sometimes trauma shows up more in the form of dissociation. And there's a dissociative subtype of post-traumatic stress in which we recognize that the symptoms are more, the world doesn't feel real to me. That's derealization. We derealize, we make something not real. Or my body doesn't feel real. I depersonalize myself. I make myself less real to myself. And there's more emotional and physical numbness. And this tends to occur more often when the trauma is ongoing and repeated, and there's no way to escape exposure to the traumatic events other than going away in one's mind or dissociating from it. And this takes us to the impact of complex PTSD, which is when trauma is ongoing, repeated, and is generally interpersonal in nature. Here we tend to see that the autonomic nervous system is very disorganized. We're not just in vigilance or hyperarousal, and we're also not in hypoarousal or disconnection from the body, but we're kind of flip-flopping between overwhelm and shutdown, anxiety and depression. And it's more accompanied with dysregulated emotions. It's hard for me to know exactly what I'm feeling or how to respond to them. And dysregulation doesn't mean that someone is bad or wrong. Often those feelings are appropriate responses to a really frightening or out of control environment. And but those symptoms continue even if there's more control now over your environment, but inside it still feels really out of control. And then there's difficulties with self-concept or self-identity. Who am I? Especially when events happen very young, they're kind of like weaving themselves into the overall identity of who you are, and you just think, I am that shame. I am that awful feeling. I am that helplessness, rather than I experienced those feelings of helplessness because I was helpless to change my circumstances back then. So The last element of this is that there tends to be more challenge with interpersonal relationships, and not a surprise. If it's hard to know how to respond to your own feelings and who you are, it makes it hard to communicate to others what you're feeling and what you might need. When we're looking at treating trauma, the intention is to try and increase your client's capacity to stay more present with and effectively respond to the range of their states of mind, the emotions they might be feeling, the sensations they're having, the interpersonal exchanges that they experience, and the fact that this is an ongoing, complex world that we live in and that we share, and that we're helping people increase their capacity to be with those complex feelings that show up inside of them or interpersonally without going into avoidance symptoms like running away from anything that might trigger that discomfort, or going into reenactment where suddenly we start blaming somebody else or reenacting abusive dynamics with others. So we learn how to stay mindful with those complex experiences or conflicts that we might have in our world. This next slide shares with you the core principles of trauma-informed care, and this comes from the cdc.gov here in the United States. But these have been pretty well adopted around the world. And in fact, NCHEM kept mentioning the value of peer support as such a key element in trauma recovery. And again, we're going to see that one here. A sense of safe enough, right? Safety is always a bit of a relative term, but a sense of safe enough. And as clinicians, when we're working with others, our own congruence forms a basis of trustworthiness and transparency. Congruence basically means that my words match my body language, match my voice tone, match my facial expressions. And so it's not enough to say the right thing if your body language is communicating something else. And so this trustworthiness and transparency means that you're willing to show up as a human first, rather than a clinician who's well defended and maybe, puts off somehow that you've got it all, figured out, right? Like we're humans too, and we actually get to show up with that transparency, which builds the trustworthiness. Doesn't mean that you're going to use the time to self-disclose all of your own struggles to people that you're working with, but it provides a basis for our compassion. And you can see that this is connected here beyond peer support to collaboration and mutuality, that we not only want to give our clients a sense that there's a mutuality of understanding in the room, but that we also sometimes need to really collaborate with the systems that surround our clients, whether that's medical systems, educational systems, family systems, so that sometimes we need to really honor and recognize that there are systemic problems and that the client's situation or experience of trauma won't really change until some of those are addressed. We want to constantly come forward with a sense of giving our clients an empowered sense of choice about whether or not this is a good time to think about something hard, choice about how they want to use their session with you, choice about how they show up in the world and with you. And that the cultural, historical, and gender issues are respected and acknowledged. I'll do one more slide here, and then I want to open it up for just a little bit of interaction time before I go into the next segment. So Judith Herman also offers the Phasic model of trauma treatment, and for much of her career, this was referred to as the triphasic model. Phase 1 being establishing stability and safety by helping clients develop resources. Phase 2 being about then we get to do the deeper dive into working with trauma in a well-paced and regulated manner. And then we go into phase 3, which is integration of any new experience or new beliefs into your overall sense of identity and relationships. And more recently, she's added a 4th phase, which has more to do with some of those systemic problems and addressing the need for justice, reparations, recognition of what happened to a person or groups of people, and sometimes the need for rehabilitation for offenders. So I will pause here and I want to specifically ask a question to you that you can start contemplating, which is, how would you define trauma? Kind of considering what we have spoken about thus far and some of the definitions of trauma that I have shared and different types of trauma. As you reflect on that, how would you synthesize your own definition of trauma? I will also share with you that this is one of the questions that I'll be inviting you to reflect upon within the breakout session at the end of this session. When you get an opportunity to discuss this whole lecture and that question in particular with your peers. So I'm going to open this up. Ayami, I know that you've been probably tracking our Q&A, which of course I am not able to track when I'm lecturing, but I would also love to open up our chat where we can maybe receive some of your definitions. If you put one in already, go ahead and repost it to everyone once we've got our chat opened. And then Oyami, if you want to we'll take just a few questions here or hands raised if someone would like to. Beautiful. And Tara, I don't know Donald Kalshed's, I'm not sure if I'm getting the pronunciation of his name right, but if you want to put that into the chat, I'm very open to learning. Beautiful, beautiful definitions coming in. Yeah, gorgeous. So one there that's very much influenced by Gabor Mate, trauma is what happens inside the individual, not the event itself. Good. Rolla, an emotional wound that decreases our flexibility and leaves us with an emotional scar tissues, again from Gabor. And Ginger, at capacity, then in the nervous system goes into either freeze or hyperactivity. Lisa, feeling helpless, hopeless equals trauma. Constantine, a wounded sense of internal or external agency. This is so potent, so powerful. Jordan says, any experience, physical or emotional, that overwhelms the nervous system. Yeah. Caroline, something that alters your psyche in a negative way and interferes with functioning. I love this one. This one comes from Peter Levine. Melissa writes, too much, too soon, too fast, without adequate support. Absolutely. Mindy, an overwhelm of the nervous system that changes how we interact with ourselves and others. Christy says, for me, a big part of trauma is experiencing a loss of choice and power and agency. And, you know, my feeling of all of this is yes and yes and yes. And I think that's what makes this discussion so rich is, you know, even if we look at the arc of the field of trauma treatment, for so long trauma wasn't recognized, and then it was only recognized in the context of, let's say, shell-shocked, right? And it began as a definition back in World War I or post-World War I with vets, and then it was only applied to those situations. And as many of you know, a lot of my work has really broadened out to complex PTSD and really looking at the impact of more subtle accumulation of repeated ongoing events. So yes, go ahead and continue to use our chat. Oyami, I'll turn it to you if there's some questions you want to synthesize.
Oyami's having a little trouble with her computer. So there's one question that's been upvoted 19 times by Arielle. How do we distinguish between trauma and distress?
So honestly, I'm not that worried about the nuance. Like if it's distressing for the client, let's go ahead and attend to it. I'm not going to apply the word trauma to it if it's not relevant to them, but a lot of the same tools that help us work with both trauma and distress are going to be valuable in both cases, right? That if the distress is manageable, if it's tolerable, maybe what we're really speaking about is someone that says, wow, I'm feeling distressed, but I can stay present with it. I can identify it. I can articulate. I can advocate for myself. Maybe that doesn't feel traumatic. We can also recognize that you can take 10 people who are all in the same bus, and this bus gets into an accident. And some people are going to experience that as traumatic, and others might experience it as distressing but tolerable. So we're going to look, even if it's distressing but tolerable, they still might need support afterwards to talk it through, to feel it, maybe to shake it off, maybe to ride through some of those waves of the distress, even if they're not identifying it as overall traumatic. And so it's not for me to say that something is traumatic because it objectively fits some description. I remember learning this many years ago, that in the process of taking a trauma history with a client or a life history with a client, and someone might describe something that you might go, oh my gosh, that must have been so traumatic that they experienced XYZ. But they're describing it to you, and either they had resource from an external source, or that they had resource from an internal source, and for them it wasn't traumatic. We don't need to layer our association of that on top of it if it's not beneficial for the other.
Awesome. And Anne Marie McKay it says, gather your client's history is like developing a map of the territory. Could you elaborate on how you initiate doing that? Do you collect much history through the intake or new client form?
Great
And
question. There are a whole variety of different ways of going about history taking. Some people will have client intake forms that they have their clients fill out ahead of time that basically are starting to gather some of that history. Personally, I much prefer to do history taking in narrative form, which means an interview form. I love to be able to slow it down, to watch, to observe, and guess what? That's not right for every client, because some clients actually feel safer being able to write about it and hand you a form. It feels just a little bit more distanced or anonymous. So you can also know that the variety of different ways out there are also going to be right for different people. There isn't a single right way. For me, what I love about the narrative form or the interview form of inviting clients to speak about different parts of their history and asking questions, and there's plenty of history taking form models out there that you can draw from, and I have a lot of them in my complex PTSD treatment manual. I have a lot of the questions that I use to ask clients to gather that history in there. Because but what's beautiful is that when we're asking the questions and we're engaging it as a dialogue, we're going to notice the affect. We're going to notice whether they're telling the story from their head, whether they're able to stay connected to their body while they're speaking about it, whether they're speaking it really, really fast, or whether they go completely incoherent in the process and they start to have a dissociative response. So we actually get a lot of feedback through that process. And it takes more time. And so if you're working with someone and you only have a really short amount of time, sometimes it's good to know that maybe we're only going to do phase 1 trauma work, because if we only have 6 sessions, we don't want to open up too much too fast. Or maybe we sense that there's enough resource that we can work with some forms, have them fill that out, and just do a nice short piece of work on something specific.
awesome. And there's 2 questions that are very much related, so I'll kind of bring them together. Sonia Bansali is saying, can you talk more about the response to collective trauma, PTSD, et cetera, from climate-related disasters, gun violence, news, to political conflict? Given that we're in a time with multiple crises happening, how does that play out in the larger culture, conversations with others, collective experience? How do you continually ground and tool ourselves and clients with practices? And Noor kind of adds to that, like, is there a terminology for, a term that captures the people are having these experiences as
Yeah.
well? So Noor can correct me if I got that wrong, but I think that that's kind of what's
Sure.
those people.
I think that the terminology of collective trauma in itself is a really important concept, and recognizing that our own nervous systems, psyches, bodies are not indistinct from the people around us and the world that we share. So I'll, share, for example, I was in North Carolina just a week ago leading a retreat. I left within days of Hurricane Helene coming through, and that the places where I was teaching, some of them are severely impacted, right? And so, because I was there and I felt so connected to that land, I spent time yesterday looking at the footage of what was happening in Asheville. And and I just needed to just give myself a chance to process that. And I know that's just one teeny tiny little example. You can, take it to what's happening in Israel and Palestine and Lebanon and in Northern Africa, and we can expand throughout the world in the situations that we're being faced with, and especially for people that are high on empathy scales or compassion, we're going to, in a sense, be impacted by those collective events much more strongly. Yeah. So having tools for us as practitioners for our own self-care all along the way is absolutely necessary, whether it's an individual exposure or collective exposure, and being able to really validate that our clients are not somehow too sensitive if they're being impacted by those events, and to help them process the waves of grief, the waves of fear that are showing up, just like we would process an individual event.
Awesome. I'm In terms of time, I know you have so much juicy stuff to share. I can like
Do
there's a lot of questions, like another 27
Sure.
questions. So do you want to wait till the end, and I'll try to compose a bunch of them and see if there's some that overlap for you.
Yes, and I would love to just take one verbal question if that's possible. Maybe choose one that has, if anyone here with their hand up has also put it in the Q&A. Thank you.
Okay.
And then we'll go right back into our material. Thanks, Denise. Yeah. Hi, Lori Lynn.
Hi, thank you for that. Just between talking about the collective trauma, um, I'm getting a little confused. I support, for me, trauma results when we don't get support. More so, like it's more so than just the experience itself. Was somebody there for us? What did they do? Did they scare us more? Did they? I deal with a lot of complex trauma, but I find it can also come down to one single, not one single, but event, and it goes back to that, and it just compounds on that.
I
So
think
is that
research would
complex
show
trauma?
I would say that the research would show that what you just named is almost universally true, that there's the event, and then there's what surrounded the event. Were you believed? Were you supported? Were you listened to? Were you respected? And if we can check those boxes, the impact of that event or repeated series of events is much, much less
Less.
versus if it happened and nobody wanted to see it, recognize it, protect, take action, then we see that the impact is much more significant, because it puts someone in a core dilemma of, especially if it begins in childhood, can I stay true to myself and still have a relationship? And if my relationship is not acknowledging what happened to me, then I have to choose the relationship, because I still need that to survive. And therefore, what do I do with what happened to me? I have to dissociate from it, or I have to make it unreal. And so we'll talk more about that in the next lecture that I have with you all on complex PTSD, but it's a good starter of that conversation. Thank you,
Okay.
Lynn.
It made it better. Thank you.
Thank you. Thank you.
Hey, Ariel, before you move
Yes.
on, one of the questions that Denise read out loud was from Nora, and she does have her hand up, so I wonder if she just want to clarify something before moving on. Would that be
Okay,
okay to
thank you.
call
Hi,
on her?
Nora. Yes, that's absolutely fine.
Yeah, hi. Can you hear me?
Yes, just fine.
Okay. Yeah. So thank you for answering the question. I think I just wanted to clarify my question around when we talk about, experiences, how you mentioned Israel and Palestine and Lebanon and what's happening there. I just have a bit of confusion to, the word PTSD, because it signifies that it happens after the trauma happens, right? So it's post. But in their experience, like it's ongoing, right? So it's
That's right.
constantly happening.
That's
And it's
right.
not only their individual experience, but it's like the political this oppression that's coming from the political powers that are overtaking the experience, right? So
That's right.
I just, in your experience, I don't know if you've worked with such a thing, but for example, I know
Right.
Dr. Samah Jaber, she says she's a Palestinian psychiatrist, and she talks about how there's no post to their PTSD. And
That's
I'm
right.
wondering whether there is a term that
Yes.
captures their experience other than complex PTSD.
That's right. The term that I usually use is peritraumatic, meaning
Okay.
that it's currently happening, it's ongoing, or the ongoing current chronic exposure to trauma. And so however we want to the terminology, I'm just so glad that you're bringing up how do we deal with the ongoing chronic exposure to traumatic stress as is happening in our world right now. And not only when there isn't a post yet, but there isn't even a horizon of that post, of when this is going to be over, which is in itself an ingredient toward that helplessness, towards the accumulation of there is nothing I can do to make this stop. And so it's profound, it's important. You bring up such a valuable point. Thank you. Thank you. Alrighty, I'm going to go back into our slides. I have a lot to share and it'll feel a little fast, but I want to make sure that you come out with the second part of our conversation, which is really about what is somatics. Like I said earlier, though, I just want to say that this conversation that you will bring with you, and it's obviously a rich and juicy one, what is trauma? Bring it with you into your breakout sessions, continue it, and to know that that conversation is actually going to continue for the next 60 hours of this program and probably for the rest of your career and whatever you're doing with this. So don't feel like somehow we're like stopping the conversation. This is a conversation starter that will need to be looped around again and again. For the sake of our time here, though, I am going to bring us into our next segment, which is this topic of the unified and integrative approach to somatic psychology. Here, we're going to look at what are the shared theoretical understandings of how does trauma impact the body. And from a somatic perspective, it tends to lead us to hold patterns of tension in our body. And we're going to look at some of the role of developmental, social, and cultural traumatic events and how they shape embodiment and identity. The unified approach, and by unified approach, I'm saying, look, there's all of these somatic therapies, somatic experiencing, sensory motor, right? Hakomi, focusing, etc. But they all have some elements of these shared theoretical understandings. They all draw from interpersonal neurobiology. They all share some methodological elements that facilitate healing drawn from the science of embodiment. For example, the role of embodied self-awareness in healing, the role of movement in healing, conscious breathing and self-expression, having a voice, being able to move outward what was taken inside. And this slide is just for a little bit of your kind of like orienting to the history of somatics. Somatics is a very broad term, and I'm going to centralize right at the center of this that our cultural wisdom traditions have almost all been somatic in nature. Dance, ritual, whether that's African dance or Buto in Japan, or fill in from whatever culture you want, right? You can think of capoeira, you can think of song and music and the role of that, of ways that communities have come to heal in, slavery situations, and the ways that collective healing has drawn upon these cultural wisdom traditions. Even Bert Hellinger in his constellation work gathered that information from his experience going to South Africa. Resmaa Menakem speaks about somatic abolitionism and the experience of post-slavery syndrome here in the US. But we have so many ways that we can draw upon those cultural wisdom traditions. And I think it's a beautiful place to start